What we're seeing today is our prototype at the end of the first year of this ARPA-H funded project. I'm Axel Krieger. I'm an associate professor in mechanical engineering at Johns Hopkins University. Welcome to the Laboratory for Computational Sensing and Robotics. And this is our SARRTS project, Supervised Autonomous Robotic Renal Tumor Surgery. That's ARPA-H funded. And what we're working on is what's called the partial nephrectomy. So nephrectomy is tumor surgery. Partial means we cut out a portion of the kidney to fully remove the tumor.
The main goal of the project is to perform surgeries better and safer than they are done right now. If you do surgery right now, the surgeon doesn't exactly know where the tumor ends in real time. Usually you have an image before the surgery and you know the extent of the tumor. But during surgery, things move around, they become squishy, and you never know how much to take out.
And so precisely removing that tumor is very difficult for surgeons. And so we developed robotic systems to help them with that. What we see here in the background is a hydrogel phantom of an actual patient kidney. We take a CT image of a patient that has a tumor and we create a mold of that that's going to match exactly the anatomy and the size and where the tumor is. So we are working on actual human data. That's the first part. The robotic system has two robotic arms. One is called electrocautery. So it's like a small metallic needle that we apply a high voltage and then it vaporizes tissue when it gets into contact with them. And the other tool is a vacuum grasper that gently grabs the tissue and then can manipulate the tumor and provide some traction. So when we perform the cautery, we can lift off the tissue and get deeper and deeper and fully resect the tumor. During surgery, we take periodic images with a camera, and that is a 3D depth camera, so it gets a surface scan of the kidney. Prior to every cut, it re-images, replans, and recalculates the best next trajectory for the next cut. So if the kidney slightly moves, if there was breathing motion, if the patient moves, we can adapt to that. And then also if the tissue deforms during surgery, we can adapt to that as well. Our hydrogel phantoms actually contain some CT contrast agent in the tumor. And that allows us to visually differentiate the tumor from the healthy tissue. So we can precisely measure how much of the tumor is still remaining and how much healthy tissue did we remove. It is very important to precisely remove the tumor. Imagine if you have any tumor cells behind, they can regrow, and this is really terrible for the patients, right? You have to do repeat surgery, maybe you form metastasis, so the lifespan of patients really drops dramatically if you leave any tumor behind.
Now you may wonder, why don't you cut more? The problem is if you cut more, you take away more healthy tissue from the kidney and the kidney will not function as well. So it's really important that you take everything out that needs to be taken out, but leave as much behind as you can because that will determine how well the kidney will function after surgery.
ARPA-H has been really transformational for what we've been doing in our lab. We started this work on autonomous surgery a while ago, but it's really futuristic. And so ARPA-H has been able to take this idea and fund this at a level where we can make such fantastic progress to something that has the potential to transform how we do surgery.